Yes, welcome to the fourth modules in health system management. We have started the second unit, which is we started with the third modules, that's second unit, and then this is the third module. The fourth modules, which is second. This is second modules in the second unit. So in our last modules, we talk about the primary health care, and there I said the next thing we are going to talk about in our next class, in the next module, is the four cornerstones of primary health care. The four cornerstones of primary health care, and that is active community participation, intra and intersectoral linkages, use of appropriate technology, support mechanisms made available. Now, if you look at all these things reflects, these cornerstones reflects in a definition of primary health care, the one that we gave in the third module. So we are looking at it, active community participation. That means the community members are expected to participate actively in primary health care practice, and that's going to help the primary health care to be successful in that particular community. Not only that, intra and intersectoral linkages. When we talk of intra, we're talking about a committed practitioner, primary health workers linking with other health professionals and highlight health to make primary health care services or delivery achievable in that particular geographical location. When we say inter means that we collaborate with people from other sectors like agricultural sectors, water sectors, and so on and so forth. Then we talk about use of appropriate technology. We need to use appropriate technology for appropriate people. Yes. For instance, if you want to meet with people, you want to educate people in the rural area, there are for instance non-educated people, illiterate people. You want to educate them. You cannot prepare handouts, reading materials for somebody who cannot read. No, you use a technology or use a method, a teaching method or teaching aids that will help the individual understand what you are passing across. Then we talk about support mechanism. Support mechanisms made available. There are a lot of things that can be or that needed to be put in place for primary health care to be made. For primary health care services to be successful in a particular geographical location. Now, part of which manpower is there, and then money is there, and so other materials needs to be put in place, made available for a success of primary health care delivery. Let's go to secondary health care. Secondary health care. The term secondary care is a service provided by medical specialists who generally do not have first contact with patients. For example, cardiologists, urologists, and dermatologists. A physician might voluntarily limit his or her practice to secondary care by refusing patients who have not seen a primary care provider first, or a physician may be required, usually by various payments agreements, to limit the practice this way. So we have from the secondary health care, this is the type of care or service that is provided by medical specialists who generally do not have the first contact with patients, for example, cardiologists, urologists, and dermatologists. So sometimes the secondary health care, they are the one that the type of patients or health care, the type of patient receive from primary health care, because it's a referral center for primary health care, for primary health care patients that have attended primary health care facilities. So we say that we have some physicians that may decide to stay at the secondary level alone, and some areas of secondary cares are also managed by allied health professions who work to co-manage that aspects of healthcare with physician, such as occupational therapists and orthotists. The orthotists. So we have some other allied health that work or co-manage patients with physician and the secondary health level, and these are occupational therapists and orthotists are examples of the allied health professions that or professionals that can work or co-work or co-manage with the physician at the secondary level. Now, let's look at some facts about secondary health system. Secondary health care is also the intermediate level of health care, which is the responsibility of the state government. Now, for secondary health care, it is, especially in Nigeria, it is the responsibility of the state government to undo the secondary health system, health care. It provides mutually supportive referral subsystems to the primary health care. So it serves as referral center for primary health care facility. It's involved in curative as well as promotive services. So secondary health care involved in curative as well as promotive services. The institution that is under secondary level include general hospitals, cottage hospitals, and comprehensive health centers. General hospitals, cottage hospitals, and comprehensive health centers. Now, let's look at the workers that works at the secondary health care institution. These are doctors, nurses, midwives, pharmacists, laboratory staffs, the X-ray technologists and technicians. These are category of people that works or professionals that works at the secondary health level. They are secondary health care workers. Now let's look at tertiary health care. Tertiary health care. In medicine, tertiary health care is specialized consultative care. It's a specialized consultative care, usually on referral from primary or secondary medical care personnel. They have specialists working in the center as personnel and facilities for special investigations and treatments. So in tertiary health care, we say that in tertiary health care that tertiary health care is a specialized consultative care. Specialized consultative care. And said it's usually on referral from primary or secondary medical care personnel. When tertiary care is a place where we get or where the patients from primary and secondary referred to, represent from primary and secondary referred to for further management, for further investigation. And the reason is because they have specialists that is working in the center. They have personnel, they have facilities for special investigations and for special treatments. So we have examples of tertiary care services. One of the examples that I have here, specialist cancer care. Then we have neurosurgery, that is brain surgery. We have bones care, and we have plastic surgery. So on and so forth. These are the examples of tertiary care services rendered by tertiary health care facilities. Specialist cancer care deal with all cancerous cases, cancers of any parts. The neurosurgery, like brain surgery, deal with care of higher degrees and higher percentage of bones. Then they also care do plastic surgeries. Also do plastic surgery and other specialized cases. Now let's look at some facts about tertiary health services. Some facts about tertiary health services. Now, number one, tertiary health care is the topmost level of health care. Tertiary health care is the topmost level of health care. Number two, they provide referral base for all cases sent from primary and secondary levels. They provide referral based for all cases sent from primary and secondary levels. So they are referral centers where cases from primary, the primary workers cannot handle, cases from secondary care institutions where they cannot handle what they cannot handle, the tertiary health services or health workers handle them. Health institution involves specialists and teaching hospitals. The health institution involved in tertiary health facilities includes health institutions. It includes specialist hospitals and teaching hospitals. This level also provides the mutually supportive referral subsystem to the secondary level, and specialists with rehabilitation care as well as training for capacity building. So they are not just to treat patients, but they are also facility where health workers, medical officers can be trained, and that's why we call them teaching hospitals. Teaching hospitals. They have the capacity and the facility to teach people, to teach medical officers. The tertiary level care is the responsibility of the federal government in Nigeria. So in Nigeria health system, while primary health care is taken care by the local government, secondary health care is taken care by the state government, and tertiary health care or tertiary level of health care is taken care by the federal government in Nigeria. This is because of the high financial commitment of the activities involved, as source specialist services, huge technology, advanced diagnostic procedures, and counseling. So, because of the huge technology needed, services of specialists, the money they are going to demand, specialists, consultants demand for. Because of all this, it is very, very, very important that the federal government handles the controls of the tertiary health institution. Control of tertiary levels of health care in Nigeria. The federal government therefore controls the tertiary level of health care in Nigeria through legislation. They control it through policy making, through standard setting, through health manpower training, through provisions of teaching committee, and by providing assistance to states and local governments. These are the area where, or the area, or let's say this is how the federal government controls the tertiary level of health care in Nigeria. So we have the references, and furthermore, I want to advise you students to read your book, go through the PowerPoint, and get the details of the message. So we are going to go further in the next unit. That is going to be our module 5. I want you to read your book, and after the whole lecture, there is going to be an interactive moment. Thank you very much. I still remain Dr. David Olusegun Awole. Thank you.